I'd like to acknowledge the presence in this audience of the person who deserves most of the credit for anything I say about what we're doing in America on healthcare, Jenny Ehrlich, who runs our Health Matters initiative. And I want to thank the people here from Verizon and GE, who are two of our important partners in this new effort we're making to try to improve the ability of Americans to take care of themselves and drain less from the healthcare system. I'm really glad to be here today for 1,000 reasons. I love New Orleans. I had one of my young aides was walking down the street with me this morning, and he's in his mid-20s. I said, "You ever been here before?" He said, "Never." I said, "The first time I walked down this street was 51 years ago, wow, when I was 15 years old." And then I took them by an old hotel called the Cornstalk Fence Hotel. Some of you have probably seen it, known by the beautiful wrought iron cornstalks. Hillary and I stayed there in the mid-70s when the University of Arkansas sent us to the annual Law School Meat Market, where thousands of people who wanted jobs teaching in law schools were interviewed by people who were doing that. And it was an assignment we were lucky enough to get a couple of times, and we always stayed there. So, and I spent a lot of time working here with the first President Bush in the aftermath of Hurricane Katrina. Hillary was then in the Senate, and in a remarkable bipartisan moment, those things have become increasingly rare. The then Senate Republican leader, Trent Lott, thanked her and said she'd done more for the Gulf Coast than any senator who did not represent a state affected by Katrina. So we like it here. And you gave me a chance to come back, and I thank you for that. I've also eaten a lot of this food here, which may or may not be good for the message I'm about to deliver. But anyway, everybody gets a day off now and then.
Sorry.
But you all know that information technology and how we manage it is critical to an effective healthcare system in the 21st century. I'm very grateful that this organization has committed $2.5 million at the last meeting of the Clinton Global Initiative to develop an health transformation project to help realize the potential of information technology to improve healthcare delivery.
That's us.
I want to talk a little today about that, but also about the role that information technology can play to improve healthcare access and leverage for ordinary people.